is Madelyn. I'll be a student nurse today, and I was just wondering if I could do a head to assessment on you.
Sure.
Okay. Before we get started, can I ask you a few questions?
Sure.
Okay. Can you tell me what year it is?
2023.
Can you tell me the name of the president?
Joe Biden.
Do you know what day of the week it is?
Tuesday.
Okay. And do you know where you're at?
Hospital.
Okay. And are you having any pain right now or any discomforts?
No.
Okay. All right. I'm just going to look at your armband, and can you tell me your name and date of birth?
Bristol Flannigan.
Okay. And your birthday?
10/7/82.
Okay. I'm just going to provide privacy for my patient and pull the curtain. I'll perform hand hygiene and put gloves on. And then to start my assessment, I will be doing the 12 cranial nerves. I will be starting with the first cranial nerve, which is the olfactory nerve. It deals with smell. And for this one, I have two substances here, and I know what they are, but she does not. And I'm going to have her occlude one nostril and see if she can identify what they are. So if you don't care, do you care to just occlude one nostril? Okay. And can you tell me what that is?
Coffee.
Okay. And then occlude the other one. And can you tell me what this is?
Cinnamon.
Okay. And she was able to correctly identify those, so there is no deformities with that. She did very well with that on each side. The next one is the optic nerve, and for this one, I will be using a Snellen chart. This is just for visual acuity, so I will actually be going 20 feet away. I'll just allow her to sit here, but here's the Snellen chart, and she will be reading. She will have one eye covered at each time, and then she will read both, and we will determine her visual acuity from that. So I will be standing 20 feet away, and I'll just have you cover one eye, please. And you can just read this line.
EFPTOZ.
Okay, and the other one?
EFPTOZ.
Okay, and just read them with both eyes.
EFPTOZ.
Okay, and that's very good. And she didn't have any issues with that. So now I am going to move on to cranial nerve number 3, 4, and 6. These are tested together. This is the oculomotor, the trochlear, and the abducens nerve. For this one, I'll be using my pen light. I'm just going to have you stare off into the distance, please. And I'm going to check to see if her pupils constrict. Okay. Okay, which they do. And then I'm just going to have you follow my pen light towards your nose, okay? Okay. And they do accommodate. She has good confrontation. Now I'm going to test the visual fields. This is the 6 cardinal gazes. So I'm just going to have you stare at my pen and not move your head, and just follow this with your eyes, okay? Okay, and as I'm doing this, I'm noting she has good eye movement. There's no extra nystagmatism, which is extra eye movements. Like I said, her pupils are round, equal, and they relax into light and accommodated. Then I'm going to ask her if she will kind of lean forward and cover one eye, and we're going to do peripheral vision. Okay, and I'm going to stand on this side. And tell me when you see my pen.
Now.
Okay, on the other side.
Now.
Okay, and she didn't have any trouble. There was no delay, and it didn't have to be right in front of her for her to see it. And then the next nerve, we will do the 5th cranial nerve, which is the trigeminal nerve. This one, we'll start off with the taste test. So this one, I have 2 substances here. I will use a tongue dispenser, and I'll dip her a little bit out and see if she's able to identify. So here's the first one. Okay.
Salt.
Okay. And then here is the second one.
Sugar.
Okay. And she was able to correctly identify those. And we use those two because they're so close together. And sometimes patients do look at them and they try to identify them before they even taste them. So she was able to correctly identify those correctly. Now I'm going to have her just kind of bite down and open and close your mouth. Okay. And open and close again at our temporal. I was feeling at her max or intertemporal. I'm not hearing any popping. Not noticing any abnormalities. I'm also going to do the corneal reflex. So I'm actually going to have you look that way, and I'm going to come in and dab. And I noticed that both of her eyes did blink when I applied the cotton to her eyelid, so they both reacted. She didn't just have one or have no blinking. So like I said, she had no popping or anything noted. So now we can move on to the facial nerve, which is cranial nerve number 7. And with this one, I'm just gonna stand in front. I'm gonna have you puff out your cheeks, smile, frown, kind of wrinkle your forehead. Okay, so I'm noticing that she doesn't have any facial paralysis. There's no facial drooping noted. She did that with ease. Now I'm going to do the sensory part, and I'm going to take a doll and a sharp object, and I'm just going to see if she can differentiate. Okay?
Soft, sharp, soft, sharp, soft, sharp, sharp.
Okay, so she was able to correctly identify those. She didn't have any trouble moving to do her facial expressions. So now we move on to cranial nerve number 8, which is the vestibulocochlear. This is where I will have you stand up. I'm going to perform a whisper test. I'm going to have you turn. I'm going to have you occlude one ear, and I'm going to whisper 2 words, and you're going to repeat them back.
Big dog.
Okay, and occlude the other side.
Tiny cat.
Okay, and she was able to correctly identify those. So that was good. No deformations there. We will move on to cranial nerve number 9 and 10, which is the glossopharyngeal and the vagus. So I'm going to actually have you say ah, and then I'm also going to start a pen light so I can see your uvula. Okay, and it is moving up and down. It is midline. And then for cranial nerve number 9, I'm going to have you stick your tongue out and check your gag reflex. Okay, so she does, her gag reflex is intact. And then I'm just going to kind of stand in front of you and actually, have you take a swallow. Okay, I'm noticing she didn't have any difficulty swallowing. Her trachea is in the midline. Didn't feel like any obstruction there. So now we will move on to cranial nerve number 11. So this one is the spinal accessory nerve. For this one, I'm just going to apply force to her head and neck, and she's going to not let me move her neck. And then I'm going to have her shrug your shoulders. Let me push down. Okay. She has good resistance. She's meeting resistance when I try to push, and when I try to push down while she shrugs. And then the last cranial nerve number 12, is the hypoglossal nerve. This one, I'm going to have you just stick out your tongue, and I'm just going to have you move it side to side, okay? So I'm noticing that she is able to move her tongue. There is no issues. There's her tongue looks fine, color's fine. It wasn't swollen. So with that one, she is good. So now I will move on to my regular head to assessment, and just as it says, I will start with head and move my way down. So for this, I am just going to start at her head. I'm looking for any lumps or lesions or deformities or indentions, which I'm not noticing. I'm noticing that her head is round. I'm looking at the hair, it's evenly distributed. I'm not noticing any signs of baldness, any alopecia, any hair thinning. Her hair texture is very soft. She is well kept and groomed. Her scalp is a little bit dry. Hair is evenly distributed throughout. She has a normal cephalic head. I'm also not noticing any nits, lice, or infestations. So that is all well. And then I'm going to move down to her face. And we'll just, starting with her face, I'm looking at the color. I'm looking for any lacerations, scarring, wounds, bruising, any redness, any open sites that I may see, which I do not note. Then I'm going to look at her eyebrows. I'm looking at the alignment of those. Those are setting symmetrical. I'm looking at the hair also on each side. It's evenly distributed. There's not any alopecia or baldness with those. And now I'm going to move down to the eyes. I'm just going to have you close your eyes. I'm just going to kind of look at her eyelids. I'm looking for any discolorations, any skin tags. I'm also observing her eyelashes, making sure she does have those, or asking why she doesn't, for other reasons. Well, she does have eyelashes. They are full. There's no skin tags noted. And I was going to ask you, do you wear glasses?
Yes.
Okay, and what do you wear them for?
Reading.
Okay, and I'm going to now, I'm just going to kind of look in your eye. We've already established that they do react and accommodate to light, but I'll kind of do that again. I'm also looking at her conjunctiva, which is pink. Her sclera is white. I don't see any signs of draining. There's no tears that I can see, any signs of infection. I'm looking at her iris and her cornea. Those all look good. So now I'm going to move down to her nose. I'm going to step back and look, and I'm seeing that it is midline in her face. And then I'm going to observe and inspect on the outside. And I'm noticing that skin is good color. There's no redness around. I'm just going to kind of palpate around. Is that any pain?
No.
Okay. Is there any pain on your face? I forgot to mention that.
No.
Okay. All right. Now I'm going to also take my pen light. I'm just going to have you kind of tilt your head back. I'm going to look in her nares. I know she has some pink turbinates. And then I don't see any signs of obstruction, but just to check, I'm just going to have you occlude one nostril at a time and breathe out. Okay. Okay, and to the other side. Okay. And just take a big deep breath for me. And I see that she has no trouble doing that, so there's no foreign objects involved. So now I'm going to move down to the mouth, also observing that it is midline. I'll start and look at her lips. Her lips are pink. They seem plump. Like again with her color, her skin tone is appropriate for her ethnicity. And now I'm going to look in her mouth. I'm looking at her mucomucosa, which is pink. Her tongue is pink and moist. Her teeth, it looks like she has all of them. Good color, good hygiene kept. Her tonsils are not red or inflamed. Her uvula is rising and falling midline. I'm not noticing anything on her gums or her soft or hard palate. No scrapes, no scarring in there. No bleeding noted. Now I'm going to move down. Actually, I'm going to look at her ears first. I almost forgot. I'm looking at those. I notice they're aligned with her eyes. They're symmetrical on each side. I'm just going to kind of look and inspect. Look at the skin color. I'm looking for any redness. I'm also going to palpate. Is there any tenderness or pain?
No.
I'm looking inside for any drainage. Is some earwax noted. Any pain on this side?
No.
Okay. I'm looking, no drainage noted there. And no pain and no redness. Now I'm going to move down to her neck. So first off, I'm just inspecting. I'll have you lift your head up. I'm looking at the color. I'm looking for any bruising, scarring, lesions, any deformities. It may be anything swollen, anything maybe just looks out of the picture. I'm also going to have you just turn to the side. I'm looking for jugular vein distension, which is a pulsating mass. I'm not noticing on this side. I'll have you turn to the other side. I'm also going to look for that. I'm not noticing it. And now I'm just going to kind of palpate around. I'm noticing that her trachea is midline, especially when you go around, it is midline. And then I'm just going to kind of palpate around, looking for any thyroid nodules. I'm not noting any. I'm also going to palpate her carotid artery one at a time so she doesn't pass out. So those are very steady on each side. So +2 for those. And now I'm just going to take a listen and listen for any roots that I might hear in her neck. So, okay, I'll go to the other side. Okay, I'm not hearing any bruise. Okay, now I'm going to move down to her chest, and normally I would have them completely stripped down in a gown to where I could be easily accessed, but for this, we're just leaving all the clothes on. but I'll explain what I would do. I'm going to start at the chest. Once again, I'm looking for any discoloration, any scarring to make note of, any open areas, bruising, wounds, any discoloration. I'll kind of palpate here where I can see, is there any pain noted around there?
No.
Any pain in your chest?
No.
Any heart problems?
No.
Okay. And I'm just looking at her shoulders. I'm looking at the symmetry. I don't see one that's larger than the other, and they're staying pretty symmetrical on each side. And now what I would do, also with her chest, I'm going to look at her breast. I'm going to palpate around for any masses. I'm going to look for any discharge that may be present. I'll teach her about doing a self-exam. And now I'm going to listen to her lung sounds. So, I'm going to go down, big deep breath. Okay, big deep breath. Big deep breath. Okay, and on the back, I'm going to go in between our scapula so I can get a good sound. So once again, big deep breath, big deep breath, big deep breath. And one more. Okay, good. So I noticed while doing that, her lungs are clear throughout on both sides bilaterally. There's no fluid buildup. I don't hear any crackles or any types of wheezing. Now what I would do is listen to heart sounds, and for that I'm going to use the mnemonic, all pigs eat too much, and I will be listening with the diaphragm and the bell of my scope. The diaphragm is used to listen to S1 and S2 sounds, and listening for any adventitious sounds. The bell is used for murmurs. So we'll get started with that. So we'll start with the aortic, which is the second intercostal space, using my diaphragm. You can just regular breathe for this. And I'll switch around to the bell. Then we'll move over to the mnemonic, pulmonic, and that's also the second intercostal space on the left side. And then I'll switch over to my bell. Then we'll move to Erb's point, which is third intercostal space. And once again, flipping over to the bell for murmurs. Then we'll move to the tricuspid, which is the fourth. Also flipping over to the bell for murmurs. And then we'll go to the mitral and listen, and then the bell. And at the mitral, we'll listen to the apical pulse for 1 full minute and make note of that. And then now I'm going to examine your arm. Since I have you upright, I'm going to look at the skin on each side. I'm looking for warm, making sure it's warm, not any discoloration, and your edema up here. I'm looking at her fingers. Her joints are all straight. I'm looking at her cuticles. They're all intact, very well kept nails, very well groomed, neat. I'm looking at her palms. And while her hands are flipped over, go ahead and take a brachial pulse. A radial pulse. Okay, and that is +2. And I'll come up and move up to the brachial pulse on each side. Okay, and it is good, it's steady. So we'll do +2 on those bilaterally. And then also while I have your hands out, let's go ahead. I'm going to just kind of move your fingers back and I'm going to push them down. And I'm going to have my fingers out here and have you squeeze my fingers. Okay, so she has good strength on each side. She's able to move her fingers and keep me from moving back and forth. Are you able to spread your fingers for me? Okay, she is able to do that. And I'm looking in between and not noticing anything abnormal. So now I'm going to have you lay back. Okay. And now I'm going to move down to the abdominal section. And here I am going to I'm going to inspect first. So I'm going to look at discoloration, any redness, maybe anything bulging out, any scars, wounds. Make sure the umbilicus is midline. Have you had any C-sections?
Yes.
Okay, so making note of that. And now I'm going to listen, and I'm going to listen in the right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant, and just listen for vowel sounds. Okay, so. Okay, and I'm making note that she has active vowel sound times 4. Can you tell me what your last vowel movement was?
3 hours ago.
Okay. Now I'm going to palpate, and I want you to tell me if you feel any tenderness or pain or I'm palpating. Just do a light palpation. Any tenderness there?
Nothing.
Over here.
Nothing.
Okay. All right. So now I'm going to do the abdominal reflex. So where she's kind of got her head raised, I'm just going to take a sharp object and I'm just going to rub down her abdomen area, and I'm going to look for reflexes as I rub this down to see if her abdomen moves, okay? Okay, and I'm noticing that she is having a reflex as I run that down. So now I'm going to move on down to the feet, and I'm going to check her dorsalis pedis pulse. And actually, I'm going to have you turn another way just to make sure. I'm going to have you turn this way and lay your head this way so we can complete this part just to make sure. Okay, now I'm going to check her dorsalis pedis pulses on top. Okay, and those are +2 bilaterally. And I'll check her posterior tibial pulses, which those are +2 bilaterally. And then as I've got her legs here, I'm just looking at the color. Her skin is warm. I'm not noticing any edema, any skin tinting. Check calf refills. They're less than 3 seconds. And while I'm doing that, also check out her hands because I did forget to do that. And those are less than 3 seconds, so that's good. Calf refills are good in all places. And then skin color is good. I'm looking at her feet. Very well kept. Her nails are all good. Very clean. And now I'm just going to have you do a few range of motion. Kind of push down, and I'll push back on your toe. Can you kind of wiggle your toes for me and spread them out? Okay, and now I'm going to have you just raise your foot back and press down and do it on the other side. Okay, and now take both ankles and move them out and move them in. Okay, now I'm going to lift your legs and do a little range of motion. I'm going to move in, back and down. I'm going to do it out and in. Is there any discomfort with that one? And I'll repeat on this side. Up, down, out, and back. And then we'll go up again, and we're kind of rotating that hip. Is there any discomfort with that? Any hip problems in the past? Okay. So good range of motion there. Now I'm going to have you sit up. That will help you. Now I'm going to just have you kind of stick your arms out for me and bring them back in. And now put them out and flip them over. And I'll bring your elbows in. And then put them out again. And then bring your elbows in. And then, excuse me. And then I'm going to have you put your hands above your head. And then bring back down. And I'm just going to bring your arm out here. And I'm going to have you bend at the elbow. Good elbow function. And then I'm just going to kind of have you rotate your shoulder back. Good range of motion there. Any pain? No. And same over here. I'm going to bend at the elbow. And then good range of motion there. Any pain with that shoulder? No. Okay. And then I'm going to have you hold your arms up. Okay. And I'm going to push. And don't let me push. I'm going to pull. Don't let me pull. I'm going to try to move out. Don't let me push out. I'll push in. Don't let me push in. Okay. And same thing with your legs. I'm going to push out. Let me push out. Push in. Let me push in. I'm going to push it. And then I'm going to pull. Okay. And she is trying to resist. She's good with that. Then I'm going to have you kind of swing your legs out. Okay. I'm just going to have you kind of move and kick out your knee. I did notice a pop in this one, but that is usually expected. Now I am going to have you stand up. Okay. Man, I think your earring's about to fall out. Now here is where I'm going to observe her back. And here I will be looking at color, any discolorations, any deformities back here. I'm going to look at her thoracic configuration. And then I'm going to have her touch her toes. And here's where I'm going to notice her spine, observe it. I'm looking for any curvatures, any signs of scoliosis, which I don't see as present. Now you may stand up. And here I'm going to check for CVA tenderness, which is the 12th rib. So I'm going to put my fist here, and I'm just going to, now did you have any pain with that?
No.
Okay. So she has no CVA tenderness. And since I've got you up, I'm going to have you take a few steps forward. Okay, and a few steps back. And here I'm observing her gait, which I see she's very steady. She's not off balance. And now I'm going to have you walk on your heels. This is the Romberg test. And on your toes. Okay, walk a little bit. I'm going to have you stand on one leg. Stand on the other one. Okay, I'm going to have you squat. Okay, I'm going to have you hop on one leg. And on the other one. And then you can sit back down now. Now I am going to do the sterogenous test. This is where I'm going to have you close your eyes and I'm going to place a familiar object in and you're going to identify it. So please hold out your hand. I'm going to put that in your hand. Can you tell me what that is?
A lotion.
Okay. All right. That's good. And now we will do the, I'm going to pronounce this wrong, the graphoparesthesia. This is where I take her palm and I'm going to draw a shape and she's supposed to identify it when her eyes are closed. So please close your eyes for me.
Circle. Square. D.
Okay. And she was able to correctly identify those. She was able to correctly identify the shape. Also, I'm going to go back to respirations. I noticed that her breathing was non-labored. She didn't use any accessory muscles. I apologize for that. I had her do that. I'm also going to check her plantar flexion. So that also requires me to have you kind of just lay back down, or you can just stick your feet up, whichever one you want. And this is where I'm going to take a sharp object, and I'm just looking for the big toe to move. Okay, on each side. I'm noticing that it moves. Now, I will be performing a Ryan and Weber test. This is using a tuning fork. The Ryan test is where I'm going to hit the tuning fork and place it behind her ear, and she's going to tell me when she hears the vibration stop. So I hit it, and just tell me when it stop. Okay? Well, sorry.
No.
Okay? And for the Weber part of the test, I'm just going to strike my palm, and I'm going to place it on top of her head, and she's going to point where she feels the vibration at. So, okay? And she was able to correctly identify those. For deep tendon reflexes, I'm just going to kind of have you kind of leave your feet dangling. Let me skip back a little bit. Okay. And I'm just going to kind of, okay. And I'm just going to do your elbow line on each side. So her reflexes are bilateral on each side, both upper and lower extremities. I'm now going to take a small pause, and I'll be right back. now I'm back. I am going to do a 2-point discrimination test where I'm going to do points on the palm, on the toes, and have her see if she can feel both points. Okay?
Yes.
Okay.
Yes. Yes. Yes.
And I'll just test on her
Yes.
lower extremities too.
Yes. Yes. Yes.
Okay, so she was able to do the 2-point discrimination test. Now I'm going to do a sensory test where I take a sharp and a soft object, and I'm going to do it on her upper and lower extremities. She's just going to close her eyes and identify where I am doing this at. So,
Leg. Arm. Arm. Leg. Leg. Arm. Arm.
okay, so her sensory function is intact. I'm going to do a vibration test. This is done on the wrist and the ankles now. So I have you put out your wrist. I'm looking for reflexes, have her fingers to move. And I do looking for anything to move when I hit it with my hammer. I noticed that her reflexes did move, and those were all intact. I have listened to her lungs. I have did all 12 cranial nerves, both sensory and motory functions. She is able to move her tongue for the hypoglossal nerve. Her eyes are equal. They have perla. They react to light and accommodate. I have checked her nose. There's no drainage. She has pink turbinates inside her mucosa. Mucosa is moist, pink. Her ears are good, no drainage. I checked her head. It's good. I checked her neck and she's able to move it against resistance. She has a good spinal accessory nerve with shrugging. Her shoulders are asymmetrical. I have checked and inspected all of her body and palpated. She has no pain anywhere. She has active bowel sounds in all 4 quadrants. I've listened to her heart in the 5 areas. I've listened to apical pulse. I've inspected her back. I did CVA. I've looked for thoracic configuration. I have noted all the pulses that I'm able to get to. They are all +2. I've palpated the carotid. I've listened to it. Skin is all good. It's warm. It's intact. Pink, good for her ethnicity, appropriate. Cuticles are all intact on both top and bottom. Cap refill is all good. All range of motion in her hips are good. I also forgot in your spine. Can you stand up for me just a second? I just want to kind of have you twist back and forth. Okay. Is there any pain with that?
No.
Okay. You may sit back down. I'm also testing her range of motion for her spine. I did her hips. We did kind of her neck. She had no popping. Also with her mouth. She's able to open and close it. I have looked. I did her arms, her elbows, her shoulders. She had no issues with that. I've also did her legs and her feet, her hand. She has good strength in those, and it's equal. She's alert oriented. I did the abdominal reflex. I did the Rhino-Weber test with a tuning fork. Like I said, I've done the facial. She's identified the taste. She's able to identify soft and dull and sharp. She is able to do the whisper test. She was able to identify those. She's able to move her tongue, the hypoglossal nerve, the vagus. She has a gag reflex. She's able to swallow without any trouble. She's breathe out of her nose easily. No labored breathing. No pulsations noted. I've checked her radial and brachial pulse. She has symmetry, no musculoskeletal development issues. Her muscle mass is good. It's even. I have done all the cranial nerves, as I've stated. I've checked her all throughout. I've asked her about a bowel movement, hips, like I said, and like I said, I would go further in depth and probably do vital signs and do a breast, to explain how to do a breast exam. Then I would document all my information, allow her to get changed back. So I think that concludes my head-to-toe assessment. Thank you.